So basically, yesterday we talked about digestive system yesterday. So we talked about teeth. So you draw the diagram or not? All anyone?
No, sir, not drawn.
Oh, why?
Not so.
Okay. So basically,
What
teeth
I
is
get it, sir.
because it is very important. So you will get the number of patients, okay, with tooth pain. So you have to examine. You have to one torchlight, one uh, tooth holder, okay, tongue depressor. So all of this thing very important because what happened for every practitioner, I am telling that we didn't examine. So this is the most drawback from our side, from in our homeopathy doctors. Understood? So we have to examine the patient in every aspect. If he complains about throat pain, you have to tell the patient, please, you have to check your throat. So it will make the impression also, and you will get to know what is the functional and structural changes you will get. Okay. Okay, understood. So please examine how to how you will exam. How you don't know the names, you have to know the structure, you have to know the function. Then only you will able to examine. So you will get the number of patients, okay, with tooth pain because nowadays everyone is eating blah blah blah. So they are taking morning tea and afternoon ice cream and again night tea. Okay, so this will affect the sensitivity. Yesterday, someone asked, you asked na, about sensitivity. Why the patients have, I am asked, a number of patients asking why our tooths are sensitive. Because of they are using the food material. In one day, they are using hot things, cold things, everything they are mixing up and eating. Okay, the body is not designed like that. The body will accept only one thing. Okay, if you are taking cold things, don't take hot things on that day, because on the whole day the circle will complete. On acupuncture also you have the circle. Okay, organ clock. So basically this is very important. Okay, examination is very important. So this is a simple diagram. You have to know the names. This is the one thing. Next, come to the topic who are focusing. Second is tongue. Okay, this is also important. Now the tongue, the number of patients will come with ulcer, mouth ulcer. Then you have to examine which part of the mouth have ulcers and number of ulcers are there. Is the ulcer is in green color, red color, white color, or mix up color? Now, these are the things we have to examine. Okay. The tongue is made up of skeletal muscle. So here is the muscle. Muscle name is skeletal muscle because skeletal will move like everything, every round. That's the name is given skeletal muscle. We will move our tongue. Okay, we'll bend it. We will make right side, left side, upper, and we will rotate the tongue, and we will make. Or if the pain is there, we will with the help of tongue, we will tell or we will calm that area. Okay, so basically, tongue is very important. So it is made up of skeletal muscle. So that's the reason it have number of movements. Okay, and it have the why the movement is there because it is connected to the brain. It is connected to the 12th cranial nerve. Okay, 12th cranial nerve from the crania. We will getting the number of nerves. So we have the 12th cranial nerves. If the 12th cranial nerve is damaged, the patient is unable to move or unable to use his tongue. Okay, on upper surface of the tongue, all small projections are called papillae. So basically, on the tongue we have number of dotted things are there. Here the tongue, no, not given. First we will study, then we will go. Many of which contain taste buds. So these papillae, these are the small holes are there. They are called papillae. First thing. Second thing is that with the help of papillae, we will able to taste. These are the taste buds. They have their taste buds. The sensory nerves of our taste are called cranial nerves, or seventh cranial nerve. So facial nerve and the glossopharyngeal nerve. So how the movement of tongue with the help of 12th cranial nerve. But the taste is coming from 7th and ninth cranial nerve, facial nerve and glossopharyngeal nerve. So you have to ask the patient. You're able to move. If any in paralytic patient came to your clinic, you will ask the patient, is there a movement? Yes, movement is there. So 12th cranial is okay. You have the taste? Yeah, slightly changes. I have the taste change in the right side, but left side is okay. Front part is okay. But bad bag is I am unable to taste. So it means is the problem in 7th and ninth cranial nerve. Okay. So taste is very, very important. Okay. In South India, we need spicy food. Okay. So with the taste only, we will eat food. So taste is very important. Is less taste, less salt, less chill. What will happen? It will doesn't give taste to us. Okay, but the tongue has other function as well. So not only taste, there are other function also. What are the function? Chewing. Okay, we will chew because with the help of tongue only, we'll able to when we are taking food, we're able to send the food to right side, left side. We will rotate the food. Likewise. Okay. So it will get the food into the teeth. And when teeth are chewing the food, so what will happen? Saliva will release, gradually. Small amount of saliva will release. So I talked about tasty food. So some taste buds activated. So we will have some saliva in our mouth. Okay. So not only for movement, it have chewing, it have taste, okay, it have to be help to the food. Elevation of the tongue is the first step is swallowing. This is voluntary action in which the tongue contracts and meets the resistance of the hard palate. The mass of food called a bolus is that pushed backward toward the pharynx. The remainder of swallowing is a reflex, which is described in the section of pharynx. So basically, other function is to swallow the food. So the last part of the tongue, the posterior part of the tongue, will help for swallow like that. So you try this action. So what will happen? Last part of the tongue will helping for the food to be enter into the esophagus. Okay. So the muscle is very important. So what will happen in some cases? 12th cranial nerve damage. So what will happen? The movement of the tongue is restricted. So the patient is unable to swallow. Is unable to swallow the food because his motor function is not working. Is restricted. The function is stopped. So that's the reason the patient is unable to swallow. There are other things also, but number one, you can check that. So here one patient came to a clinic. You have to examine. He told, I have pain on my tongue. I have numbness on my tongue. Okay, you have to examine. So which part of the tongue is affected? How is the motor function? Is there any mm, uh, taste changes are there? Is able to chew the food. All this examine you have to do. Okay, understood. So let's see the tongue. So basically, this is the so these are the tongue image you have to. So you're able to see the image. So basically, this is the epiglottis. This is tonsils. These are the tonsils. These are the palatal tonsils. The lingual tonsils. These are papillae helping. These are the most the tongue. Okay. So these are the papillae. These are the also papillae. Okay. And here the apex. Not all the names we need, but you have to remember uh papillae, main of the papillae. These are the papillae. Okay. All these are papillae. The body, apex, front part, and the posterior part. This is the body. Okay. So if you remember, good. Not, you have to remember 3 to 4 names which are important: apex, body, and papillae. Because papillae have taste buds. These are the epiglotis. These are the tonsils. These are the lingual papillae, which are the circular in motion, circular in. Okay, understood. So this is very important to us to know about our own tongue. Tongue have 12th cranial nerve, 7th cranial nerve, and 9th cranial nerve. 7th and 9th for taste, 12th for movement. And we have salivary glands next. What we have? Salivary glands. Salivary, the digestion secretion in the oral cavity is saliva. So digestion is starting from mouth itself. Saliva is coming from that area and we are chewing the food. The saliva is mixing with that food. We have the salivary glands. We have parotid glands, submandibular glands, and sublingual glands. Parotid glands are below and front of the ear. Here we have the parotid gland, submandibular gland, sublingual glands, 3 glands. Okay, each gland has its least one duct that takes saliva to the oral cavity. So we have saliva from that area. Secretion of saliva is continuous, but the amount of varies in different situations. The presence of food in the mouth increases saliva secretion. Gradually, we have saliva in our mouth always. Okay, because we have to wet net in our mouth. So this is very not disturbed, but is dryness is in the mouth, it will disturb us. Okay, so basically, when eat food, the saliva increases. Okay, the presence of food in the mouth increases saliva secretion. This is parasympathetic response mediated by the facial and glossopharyngeal nerves. The sight or smell of food also increases secretion of saliva. Sympathetic situation stimulation is stress situation decreases secretion, making the mouth dry and swallowing difficulty. So basically, what will happen when in foodie mood, when smell is coming, saliva increases. Saliva increases, it will help us to eat food. But in stressful condition, when we are angry, we have to fight, we have a stressful condition, depression, the saliva decreases. It will constrict because the amount of brain you are using, the energy transfer to that area. So that's the reason the energy is decreased here. Okay, so whenever your patient comes and you have dry mouth, you can assume that he is a patient of some stress situation. Assume, not confirm. Okay, saliva is mostly water. That is only water, which is important for dissolved food for tasting and to moist food for swallowing. So what will happen? What will it will do? It will digest the food and it will able to swallow the food easily. The digestive enzyme in saliva is salivary amylase, which break down starch molecules to shorten chains of glucose molecules or maltose in disaccharide. Most of us, however, do not chew our food long enough for the action of salivary amylase to be too effective. As you will see, another amylase from the pancreas is also available to digest starch. Okay, saliva is made up from blood plasma and thus contains many of chemicals that are found in plasma. Considerable research is focused on detecting saliva chemical markers for diseases such as cancer with the goal of using saliva rather than blood for diagnostic tests. So here the saliva, it have chemical. What is chemical? That is amylase, salivary amylase, which help to digest the break down the starch molecules, which is very important. So we didn't swallow the chew the food properly. Then we chew the food. Then only the amylase will break down the molecules will happen. Okay. If we doesn't chew the food, what will happen? It will it will have problem. Okay, problem. So basically, uh, we have to chew the food, very important, because it has amylase. Okay, pancreas also releasing amylase, but after digestion, after entering into the uh, small intestine. Okay, so there's the reason we need amylase. Okay, so this is all about, we talked about tongue and salivary glands. Let's see salivary glands. You can see these are the salivary glands. These are parotid gland, conduct in the mouth, submandibular gland, sublingual. Okay, so these are the parotid, submandibular, and sublingual gland. So you have to examine the patient also. Okay, examine the patient. Okay, you will get the idea, clear picture idea. So this is all about the today's class. If any doubt, you can ask.